Hi, I'm Dr. Stanley Feynman, and I'm an allergist. There are many people who feel a lot of different ways about allergies and allergists. But the reality is that people don't understand how an allergist can help you. Are over-the-counter drugs bought without a prescription your best bet for allergy medication? Are your hay fever symptoms caused by an allergy? Allergists can answer these questions and more, providing invaluable expertise in the diagnosis and management of allergies and asthma. Today in our segment, Why See An Allergist, we're going to focus on hay fever, also known as rhinitis, because allergies and asthma are serious diseases, and that's nothing to sneeze at.
Hi, I'm Dr. Jim Sublett. I'm an allergist, and I'm here today with Sandy Gordon, who has a lifelong history of allergy. Actually, as a child, Sandy took allergy shots, but she's continued to have a lot of allergy symptoms in her adult life. Sandy, you want to tell us a little bit about the kind of problems that bother you as far as the rhinitis and upper respiratory allergy symptoms you have?
Well, I have what I guess is just called hay fever. So, but it's not seasonal particularly because I sneeze all year long. I've tried over-the-counter things. I'm not very good at taking medicine, but I'm here because I really do need help with this.
You know, what people don't realize is most of the over-the-counter medicines are designed for milder allergies. Where the people have more moderate to severe allergy problems, it's very rare that over-the-counter medicines are enough. And another thing that's very important is to identify what you're allergic to. 2/3 of people, majority of people that have allergies have year-round allergies like you do. They're suffering year-round. And if you ask the average individual, do you want to have a bad cold for half your life? Most people would say no. Many people that have significant allergies, the moderate to severe group, they benefit greatly from allergy shots, or what we call immunotherapy. When you have allergies, you tend to get on the allergy track, and what we do with allergy shots is shift you off that track onto a track that's not allergic, and it gives you long-term benefit.
So you can still do that for somebody my age?
Sure, allergy shots can really be the way to go. Now, do your ears bother you when you're having a lot of your rhinitis symptoms?
Yeah, frequently they get plugged up.
Yeah, actually, this ear looks a little plugged today. That's called eustachian tube dysfunction, which is a big long name that means your ears plug up, and oftentimes that's due to allergy. Now, I know you told me your eyes bother me,
Yeah.
bother you, not me, but let's check your eyes out here. Yeah, they're a little bit injected. Not too bad today. Of course, that may be during the seasons. Is that more during the pollen season?
It's worse during spring and fall, but I can get it anytime.
Like if you go in the bookstore and things like that. So that may be a threshold effect of how allergic you are. Sometimes people will have a little bit of problem that they don't pay much attention to, then all of a sudden they get around something where there's increased levels of exposure and they really get plugged up. You told me earlier coughing is a pretty common symptom you have. That's the #1 symptom of asthma. So if your history of asthma, we should do some lung function testing, determine where you are. I sometimes see people who are totally without symptoms, they have lung function that's way lower than it should be. I'm pretty sure we're going to put you on allergy shots, and people don't like shots. I mean, who does?
No,
but
I don't.
The one thing to remember, the allergy shots are very, very tiny little injections. You can see how small that needle is. And the good news, over a period of time, we're actually eliminating a lot, not only your symptoms, but other medications you may need. So we know from a standpoint of looking at allergy shots, they're cost effective. They reduce things like sinus surgery. Certainly people have asthma, the urgent care visits can cut down on your antibiotic need, which can be very expensive. And so allergy shots, even though on the front end they have some cost involved, long term they have cost savings.
Allergies are quite complex, but when properly evaluated by an allergy expert, that complexity can be solved and turned into a well thought out and simple to administer treatment plan. Thank you for watching, and tune in to other American College of Allergy, Asthma and Immunology segments about how an allergist can help you. Till next time, this is Dr. Stanley Feynman, your host for this segment of ACAAI's series, Why See An Allergist? Because allergies and asthma are serious diseases, and that's nothing to sneeze at.